You're gonna. Yeah, sure.
I'm not.
Yeah, appreciate my.
You got it's nice. It's like nonstop.
Yeah, I know. It's oh, you do.
Yes,
And because my ROACA, and I just very oh,
and now they play in school.
hi.
It's all about the house, like. So anyway, that I think I should.
Microphone for the, you have to talk into my. Because, oh, good, because microphones are fun for the, yeah, so everybody here. Just have to hold it. So those are just. Yeah. Yeah. Yes. And over the students. I'm also some other bookstore on it. Actually, I got it from 500. But they did a lot of edge marks that also.
I was trying to get you eating my popcorn without.
Yeah. No, you did?
I forgot.
Oh my God. Hey. Hey, you need this food.
You go back.
That's fine.
No, sorry.
I didn't know see Brazil oh, you know what? I can have one good on it, but the end comes to Gary Way. And then you do it. The whole thing like oh.
All that stuff.
Maybe he didn't come around.
It's off right now.
Yeah, potatoes.
All right, we're going to get started, everybody. I just want to make a couple of announcements before we get started. If you've checked out a library book in the back and you've had it more than a month, it's always a reminder to turn it back in so we can cycle through those and get, sometimes people are waiting for certain ones. So, but you can have it for definitely up to a whole month, 30 days. So just as a reminder, if anyone has any still checked out. So welcome. And anyone been here? Is this the first time for anybody? All right, excellent. How did you find out? Both these two brought you in. Great, thank you. We always say that bring family and friends, the more the merrier. And how did you find out about it? Right here. Okay, excellent. Welcome. Glad you're here. And for those that are new, there's check out the stuff in the back. We have the flyers for the class schedule. We have the lending library course. The bathrooms are in the back on the left. Also check out the website if you haven't yet, the livelifestylemedicine.com, which there's little cards in the back there. And watch the website tutorial on the homepage. It kind of gives you a tour of everything on the website, how to access all the resources. And then you can also get on I really encourage everyone to get on the newsletter list too, because once you sign up there, you'll see at the top of the homepage, you'll get a update every Sunday morning. We'll initially get a welcome newsletter if you're new. And then every Sunday morning, you get a weekly update. And then the beginning of every month, you get an actual newsletter that comes out. So it's always a good way to keep up with the class schedule, all the things that are going on. We also have all kinds of community events going on. We do potlucks and cooking demonstrations and walks and movie nights and grocery store shopping tours. So we have all kinds of, through our Live Lifestyle Medicine program that's supported by the Eugene Plant-Based Providers, we have a lot of other events going on besides just these classes. And also Charlie teaches classes at Natural Grocers on Wednesday afternoons. So you'll get the information for all of that stuff if you want more than just what we have here tonight. So every Tuesday. So any questions, comments about anything before we get started? Do you have anything to mention about I did. Oh, okay. About the checking out. Yeah.
So I just wanted to practice my balance. At 77, the tennis court helps maintaining balance. Anyway, what I just wanted to say is there's the Vegan Fest that's coming up May the 3rd. So mark your calendars. We want to see as many people as possible come out to that. There were 1,500 people came last year. This year, Dr. Michael Clapper is coming to this area. We're kind of having him come out. He's going to spend some time. He's going to be speaking at the Vegan Fest, but the room is kind of small. So we're going to have another venue, and I found one today. I think it's Springfield High School, 800 people it holds. So I think that's going to be a Monday night at 6:30. That's the May the 4th. So put that in your calendar. And if anybody wants to help bring him out here, that would be great also, for those of you who want to kind of maybe sponsor it if you're able to do that.
How do we do that in case we don't know?
How would you do that? It would be kind of like donate to Eugene Plant-Based Providers, but say for helping bring Michael Clapper to here. He's not charging his usual fee. He has a new book that's coming out in April, and he's going to do a book signing at the time. And so he's going to come stay at our house. He's lucky because he has a kitchen that's one of the best in the world. There's a chef that's right here, Kristin, my wife, for those of you who don't know. And so I'm feeling very comfortable.
Nope,
He's going to
sure.
be very happy with the food choices. And let's see, what else can I tell you? We're even talking with Roseburg because we kind of got started in Roseburg, and they may have the doctors down there meet with him in a special session. So we're kind of trying to work together and make this a big event. So however we can get 800 people, I'm not sure. Dr. Greer got 800 and 1,000 a couple of times when he came out. I don't know if we can do enough advertising. We're going to try it. Yes.
Springfield High School on 58th Street.
No, I think it's on 8th Street. Yeah. Huh? It's got a beautiful auditorium. It's a really nice place. I looked online. It's like, wow, this is a nice place. So anyway, I don't want to take any more time. Yes. The date is May
3rd is the
3rd for the Vegan Fest and 4th for the talk. Okay. It's 2 days, Sunday and Monday. Double opportunity. The problem with the one day at the Vegan Fest is the room only holds like about 50 or 60 people. And I think he deserves a bigger audience than 50 or 60 people. And so that's why we arranged the second talk. Now, without further ado, you are lucky tonight because you have got, someone to jump up and down for. I'm excited, not only for Dr. Linzmeyer, who I think you'll find really engaging, but for Cecilia Jacobson, who's a registered dietitian, who I've known for a long time. really happy both are here. So carry on.
So I'll just introduce myself a little bit more. I'm Dr. Kristin Linzmeyer, and I'm board certified in cardiovascular disease. I work at Riverbend with Oregon Cardiology, and I'm also board certified in lifestyle medicine.
My name is Cecilia. Like Charlie said, I'm a registered dietitian as well as a certified diabetes care and education specialist. I also work for Peace Health. I've been there for about 20 years in nutrition. I did start in the inpatient world and then now work in the outpatient world and do a lot of outreach and wellness stuff and, try to educate people on plant-based eating and how good it can taste.
So, Cecilia she works currently in our cardiac rehab department. So she works entirely with patients who have had a cardiovascular event, a cardiovascular surgery, stents. That's who she works with. So if you have any questions, especially nutrition related questions or rehab related questions for her, with regards to what's healthy for your heart, what you shouldn't eat, now's the time to ask her, to snag her attention because she's hard to get. So, what we thought today, instead of, for any of you who've been here before, I usually have this presentation that's a pretty quick paced, rapid fire presentation of all things cardiac and cardiovascular, and it's a lot. And I thought that today, and we do these cycles of presentations quarterly. So if today's format doesn't appeal to everybody, we can go back to the similar, the previous PowerPoint presentation and then have questions at the end. But what I thought I would do is change it up a little bit and have more of like a panel discussion or a question and answer format. So if you have any questions regarding any form of cardiovascular disease or nutrition related to how to prevent cardiovascular disease, that's what this is for, is to just kind of go back and forth. And hopefully as people start to ask questions, it'll lead to more questions. If we find that we are kind of stumped and there aren't a lot of questions, I was going to get into like my approach to hypertension or high blood pressure, which is the #1 risk factor for cardiovascular disease. I'm not talking, it's #1 risk factor in the form of a disease. So the #1 modifiable risk factor in the world for premature death and disease is our diet, is nutrition. But then you can start developing these, if you're not, having a healthy lifestyle, you can start to develop these diseases that are risk factors for worse outcomes. And the #1 risk for cardiovascular disease is high blood pressure. And so I wanted to just touch a little bit briefly on that and the importance of it, because worldwide, it's in the hundreds of millions of people who have it. And it used to be thought of as an age-related thing. Your blood pressure normally goes up as you get older. In fact, I read recently, I think it might have been Michael Greger's, one of his books, that doctors back decades ago were taught that a normal blood pressure as you get older is 100 plus your age. So if you're 60, that means normal blood pressure is 160. So we know that that's not correct anymore, right? We've known that for years and years and years now, thankfully. So unlike cholesterol, which lower is better is our new mantra, lower is better. I mean, yes, we have these targets, but even lower than that is better. With blood pressure, there's a sweet spot. Too low is very dangerous. It's not compatible with living. And too high is very dangerous, and it leads to a lot of really awful outcomes like congestive heart failure, heart attacks, aneurysms throughout your aorta and your blood vessels, strokes, not just the strokes where your arteries start to close off, but the hemorrhagic strokes, which are just devastating. Certain types of abnormal heart rhythms like atrial fibrillation. And high blood pressure, along with diabetes, are the top causes of kidney failure and the need for dialysis in our country. So it also can lead to blindness. So, I mean, just these devastating outcomes, and hypertension or high blood pressure is considered the silent killer because most of us don't know we have it unless we're checking, or we have an outcome, a stroke, and like, oh, how long has your blood pressure been this high? Oh, I felt fine until I had my stroke. So, so anyway, I can go into a little more depth about high blood pressure, but we thought just for fun, we'd open it up and just make sure if anybody has any questions, something that's just been really nagging them and they are desperate to ask, go ahead, speak now or forever hold your peace, or else we'll just keep talking. Yes,
Heredity.
about,
Well, when your father died at 56 and your mother goes, your new doctor always goes, that's a red flag. And how red is that flag?
I mean, it's still a red flag, but your genes don't mean it's your destiny. Okay, so you can have a genetic predisposition to something like a heart attack, dying young from a heart attack. But usually what it takes is the genetic predisposition plus something else. And that something else is usually your lifestyle. So it's something that you need to pay attention to. It's a red flag, but it doesn't mean that there's nothing that you can do about it. And we hear this a lot that, oh, I've got a family history. Like, well, yes, but you also could quit smoking. And no, seriously, I have people who smoke and they've said this to me. And I said, your number one risk factor is smoking for you to, you already have plaque in your arteries and I don't want you to have a stroke. Yeah, I've got a family history. Okay, let me repeat myself. Your number one risk factor is your smoking, so it is a red flag. So then what that should prompt people to do is say, okay, I'm paying attention. I've got a family history. What can I do to prevent the same outcome that my dad had at the age of 46? Okay. Now there are other things to check. You're going to want to keep an eye on your blood pressure. There's certain cholesterol abnormalities that can be very hereditary. You're going to want to get those screened for. Okay. One of them is called lipoprotein little a, LP little a. Everybody should have that checked once in their life. You only need to have it checked once. LP little a or lipoprotein little a. And that is something that's very hereditary. It has nothing to do with your lifestyle. And if you have it elevated, that means your kids could have it. It could mean that your siblings have it. So then they would need to get screened. Okay. So to answer your question, it is a red flag, but it's not your destiny. It doesn't mean it has to be doom or gloom. Anything you want to add?
Just talking about genetics, like OHSU has a program, epigenetics, and you can turn your genes on and turn your genes off based on lifestyle choices and food. And think of food as medicine or food as poison. You pick.
Yeah, so I'm interested in cholesterol and aging. Because, what is the variable of aging and how does it interplay with cholesterol being high or low? So as we're aging, is there some of that can boost the cholesterol to unhealthy levels? I used to go to a naturopath that was telling me that don't worry about cholesterol at all. Now I'm not well versed in everything she said. This was years ago, but I know how smart she was, and she was saying there's a hype about cholesterol to some extent, and I don't know. I'm not sounding very informed about it, but please inform me because a lot of people are told that cholesterol is too high and that's what we aim for, so lower it. Whatever it is, the HDL or the LDL, whichever one. Anyway, and so she was saying that's not as much of an issue, but anyway.
So the question is
Is there a question?
how related is cholesterol to aging and how important is cholesterol?
Yes. Yeah. Help.
Okay.
Yeah. The levels.
So, when you look at studies that have just looked at the level of cholesterol and your risk of having a bad cardiovascular event, it is, let's see, so I'm going to go the other way for you. It's a line like this. Okay. The higher your cholesterol, the more likely you're going to have a cardiovascular event. So when it comes to atherosclerosis, which is the plaque that clogs up your arteries, and there's lots of even different types of plaque, but cholesterol is the foundation. It's like the building blocks of that atherosclerosis. And then on top of it, if you want to think of like the salt in the wound or the lemon juice in the wound, is inflammation. So if somebody were to ask you, what are the two things that cause atherosclerosis? It's cholesterol and inflammation. So absolutely cholesterol matters. Now, as far as age, we tend to see if somebody's cholesterol has been elevated, and it takes years and years and years for it to really start to cause problems in your arteries. So you could have higher cholesterol or higher than it should be in your 20s. You're going to have clean looking arteries. And then as you reach your 30s and as you reach your 40s, your cholesterol could stay exactly the same, high, but exactly the same and not go up. And you're going to have more plaque, more plaque, more plaque. So that's why it's not that cholesterol is necessarily higher as you age, but you've had decades for it to do its damage. So that's number one. Number two, one caveat to that is in women, because women's natural hormones, especially estrogen, tend to keep our cholesterol levels nice and low for most people, most women premenopausal. So then you go through menopause, whatever age that is, it averages between about 45 and 55. And then over those next 10 years after menopause, your cholesterol can really start to creep up. Not because you've changed anything, but because you've lost those protective hormones.
Thank you. Yeah.
Information. Where do we get that?
Inflammation is a little difficult to define exactly what it is, but they're actual inflammatory molecules that can circulate through your blood and that can directly cause damage to your blood vessels. And big sources of inflammation are through our diet. Also, big sources of inflammation is through our diet and then processed by unhealthy microbes in your gut. And so you're going to have a really healthy gut microbiome if you feed it really healthy foods, and they will produce anti-inflammatory factors that then help clean up your blood vessels and help them heal or protect them from further damage. If you feed them the wrong foods, the junk, the standard American diet or SAD types of foods, then the unhealthy kind of bad microbes, and there's actually certain ones that they've pinpointed that are really, really harmful for you, they're going to contribute to leaky gut and endotoxins that then cause all the damage in your body. And there's the data or the research on the importance of a healthy gut microbiome with what we feed it it's kind of mind-blowing how it can affect mental health disorders like depression or anxiety, how it can affect dementia or your risk of developing dementia, not to mention risk of cardiovascular disease, and possibly some contributions toward certain cancers. So anything else you want to add? And sorry, but she's going to probably talk more about nutrition because she's the expert there. But you can have higher levels of inflammation due to other factors also, like certain toxins, excessive alcohol, poor sleep, excessive stress, which kind of chronically raises your cortisol and your sympathetic nervous system. All of that can be very inflammatory as well.
So if we think about food as medicine and trying to create a more anti-inflammatory environment in our bodies, think of fruits and vegetables. So fruits and vegetables would be like if you hire a maid or if you hire the Merry Maid service to come in and clean your house and get everything tidied up. That's what fruits and vegetables are going to do inside your body. They're going to tidy everything up and clean it up. And that's the other importance too. Like, I don't know if you've heard a lot about added sugars. In the packet I handed out, there's a nutrition facts label on there. So what you want to look at is the included added sugars. So that's the refined sugars. Those are not good for you. Those cause a lot of inflammation in your body. And that's why, we discourage added sugars. If you want yogurt and fruit, then buy plain yogurt and put your own fruit in there. And then you're getting yogurt and fruit. Otherwise, I always challenge people, show me some identifiable fruit in there. It's a beautiful red color or purple or whatever, but there's no fruit and just a ton of added sugar. I mean, a prime example is like Chobani's vanilla yogurt, the Greek yogurt. There's like 11 grams of added sugar in there for no good reason. If you want it to taste like vanilla, put a little vanilla extract in there. It'll taste like vanilla. You can use fruit, you can use dates to sweeten it. Totally fine.
So, Cecilia, if you were to give people like one or two take home or actionable points on like how to reduce inflammation through your diet, would it be look for the added sugars and eat more fruit?
More fruits and vegetables.
More fruits and vegetables,
Yeah.
and look for the added sugars.
Yeah. The added sugars. So to give you a number to quantify it, for women, it's no more than 25 grams per day, which is 6 teaspoons. And for men, it's no more than 36 grams per day, which is 9 teaspoons of added sugar.
What's the best way to sweeten? What is the best way to sweeten other than just fruit? Like, is there maple syrup, honey, molasses? I don't know. Any ideas?
So the question is, what's the best way to sweeten things? So you can use honey, you could use maple syrup, you could use dates, soak dates and make like a date paste. You can make compotes, like boil down berries and pour that over stuff. Kind of just using real food. What would your grandparents or great grandparents identify as food? Probably what you should eat. And know how to pronounce it.
Yes.
Can you read that?
Can I read it?
Yeah. What about statins?
Oh, no. Oh. I'm like, no, I can't read that. What was that? Okay. So that's like, that topic could take an hour or two. So the answer to that question is, in general, good, but not necessarily for everybody. Statins are good and they can be life-saving for the right person. So let me give you some examples of people that statins might be really, really beneficial for. If you have already had documented plaque in your arteries, needed a stent, had a stroke, had a heart attack, had bypass surgery, had an aneurysm repaired. Am I missing anything? Yeah. Okay. Those people will live longer and have fewer future events than on statins than if they don't take one. So then let's get into the bigger category of what about the people who've never had one of those events? That's the majority of us. That's people who are trying to prevent their first event. It's primary prevention. There are some people who absolutely should be on a statin. And one of those categories of people is if their LDL, the really bad, harmful, inflammatory cholesterol, is over 190. It's a really high number. Absolutely. You could argue that some people, if their LDL is over 160, should be on it, especially if they have a lot of other risk factors to really get their cholesterol down. And then under that, and even if it's a little over 160, my approach is, depending on what their other risk factors are, if they don't really have a lot of other risk factors other than that high cholesterol, then no, statins may not be the first thing I reach for or the first thing I recommend. My recommendation would be, let's talk about what you're eating. Let's talk about what you're not eating. Let's talk about your weight. Let's talk about how much exercise you're getting. So things like that. And so the answer to that question is very complex and it is very, very person specific. We base recommendations for taking statins on studies that have looked at thousands and thousands of people, big populations of people, and have found that in general, for large populations of people, statins, yes, indeed, do decrease your risk of having an event. But it's taking these huge populations, not necessarily looking at the individuals, number one, and number two, depends on what time of life you start them on a statin, like what age, and what their additional risk factors are. So if you have somebody who's got maybe a mildly high cholesterol, mildly high LDL, and they have diabetes, and they smoke, but they're trying to quit, and they have high blood pressure, and their dad had a heart attack at the age of 50. You know, yes to all of the lifestyle factors, but we need to get that cholesterol down really low. And a statin may be a good choice for them in addition. But if you have somebody whose cholesterol is mild to moderately elevated, like up to 160, or maybe even a little higher, and that's the only risk factor they have, and they don't have evidence of a lot of plaque already in their arteries, there's certain screening tests that you can get, such as a calcium score to look for those things, or an ultrasound of your neck arteries. It's called a carotid ultrasound. Your carotid arteries are the big arteries that go up to your brain. You can look for plaque there. If they don't have a lot of those other findings, then let's work on lifestyle. Let's work on decreasing that saturated fat in your diet. Let's work at eliminating as much of your dietary cholesterol as possible. Let's work on gradually and slowly increasing the amount of fiber in your diet, which only comes from plant-based sources. I had a patient this past year, just a couple of months ago, or I saw her back a couple of months ago, whose LDL was 187. Absolutely, really should be on a statin. But she didn't want to. And I'm like, oh, that's fine. Okay, you don't want to. We talked about it. But then this is what you need to do. And you need to do this anyway. But then this is what you're left with. And she 100% went on a whole food plant-based diet. And her next LDL was 107. She was able to drop it by 80 points just by switching to a whole food plant-based diet. So, like she said, food is medicine. So in her case, I think, she didn't already have a lot of plaque. Hopefully we were able to catch that, before major damage was done. And I told her she was my poster child, so.
How long did it take?
Well, let's see, it was checked in the winter and then I saw her back 6 months later. Yeah, we rechecked it. Yeah, something like that. Maybe it was 8 months. Yeah.
There's been a real emphasis on nutrition, and just how dramatically it can, reverse, the disease process. The sad diet. I've been an athlete all my life and athletic conditioning and all that. And I'm 74 now. And just as it's important to be on a vegan diet, it's absolutely essential for my quality of life that I keep moving. That is mandatory. And all of the flexibility and strength and all of it. So about 3 years ago, I was in the hospital with a weird virus. And AFib, dehydration, and they didn't know what I got. They still don't know what it was. I ended up with nerve damage, and now I'm taking warfarin. And they say, you gotta stay on this for the rest of your life. But I like doing things with my hands. And so consequently, I make accommodations with gloves. But there are times when I bump my very thin skin and I get bruised or just little tiny scratches, bleed all over the place. But do I really need to be on all this stuff, or is that more of a specific cardiovascular question, lifestyle question? But where do I go from here? I just don't want to go to a standard cardiologist who's going to say, get the MACE procedure.
So yes, that is a very, very specific and very individual based on your individual risk factors. But the short answer is that there are options other than warfarin. And you would really need to meet with a specialist, even a very specialized cardiologist called an electrophysiologist, to talk about what those options might be, especially if you are somebody who has what we would call a low burden of atrial fibrillation, meaning you had that one episode when you were practically septic, it sounds like, and maybe you haven't had any since.
So come up on my watch.
Yeah, right, exactly. And those smartwatches, they actually can be pretty smart for some things. So So that would be a very, very specific question to go and see a very specialized cardiologist to discuss your options. But short answer is that these days we actually do have options for people who want to get off their blood thinners.
Thank you for being a reference letter.
I had an incident, earlier this year. It was hypertension and, when I started bleeding, I lost this one. Oh boy, yeah. And Dr. Chu saved my life. Yeah. But anyhow, long story short, here I am. And, I was sent home with 24 different medications. It's slowly taking me off on, so now I've got 10. And I asked them, exactly what am I taking this for? What is, what? And I can't get any definitive answers. And I don't want to be stuck taking 10 medications a day.
Right. So, do you want to talk a little bit about nutrition to treat or lower blood pressure? And then I have a couple things to add. So her question is high blood pressure or hypertension, and I'm on medications to prevent another bad event or outcome. What are some things I can do to get off some of these blood pressure meds?
Yeah.
So if you look at the label, the nutrition facts label on there, one of the biggest things that you want to watch out for, like we talked about sugar, you want to watch out for salt. So salt is going to increase your blood pressure. The goal and the recommendation is the general goal, no more than 2,300 milligrams, which is 1 teaspoon of salt per day from every single thing that enters your mouth, not just the salt shaker. So it's great if you don't use the salt shaker. That's fantastic. There's tons of herbs and spices you can use to flavor food. Onion powder, garlic powder, basil, cumin, sage, thyme, oregano, cinnamon, clove, nutmeg, whatever you want. Food has to have flavor. But we want to stay away from the salt. You need to watch if you buy anything that's packaged, even if you're buying canned beans, because that is generally a good choice. Buy low sodium or no salt added. Drain it, rinse it, use it. Even the low sodium beans, they're still like 140 milligrams in a half a cup. If you drain it, rinse it, now we only have 70. Watching different condiments, if you use ketchup or mustard or, just condiments have a lot of added stuff in there. So if you can get away from a lot of that and you can find no sugar added ketchups, no sugar added red sauces. Look for low sodium versions also, or make your own. Just buy canned tomatoes and then add basil and then add garlic to it and puree it up. And then you have control
Make your
over
own
that.
salad dressings.
Sodium is low from the lab. Because to me that meant eat more salt.
With the exception of a couple of medications that can affect this, that lab sodium, your body is just exquisitely, it's like a finely tuned machine in how it can regulate the sodium concentration in your blood. That number sodium, it's a concentration. It's not the total amount of sodium in your body. So what it means is that if it's a little low, it means that you have a little too much water for the amount of sodium. And your kidneys are really, like I said, just exquisitely designed to help regulate that. So even if you're eating 4 or 5 times the amount of sodium you should, your blood level sodium should be normal. It's not going to be high. But because your kidneys are going to hold on to more water to keep the concentration the same, that water, it's kind of like filling up the tank. And the tank is going to start to get really full, really kind of distended, and it raises your blood pressure. So yeah, it should not affect that. And like I said, there are some medications, they're usually diuretics, some of which are blood pressure medications that can make your sodium abnormally low on your blood tests. Is there anything else you wanted to add nutrition wise about blood pressure?
I was going to add in about fruits and vegetables. So fruits and vegetables, if Americans weren't so adverse to green foods and fruits and vegetables, we wouldn't all be walking around with hypertension. So if you think about your cell, try to hold on to this and show you at the same time. So your cell is brown. Salt likes to live inside of the cell. Potassium from fruit and vegetables lives outside of the cell. More fruits and vegetables you eat, the more potassium is going to push into the cell, pushing the salt out, and you're going to excrete it in your urine and feces.
Now, what about like counted salt and modern salt and such?
All salt is salt. It's all going to raise your blood pressure. Yep.
But you need certain amounts.
2,300 milligrams, which is not a lot.
And you can get almost all of the sodium your body needs without actual salt. The small amounts that are in fruits, vegetables, beans, whole grains is plenty for what your body needs. And like she said, what did you say? 3/4 of a teaspoon or 1 teaspoon? 1 teaspoon. I mean, that's more than enough for what your body would need. So I just want to comment a couple of other things about high blood pressure. In addition to low sodium diet, ideally, the American Heart Association and the new high blood pressure guidelines are recommending that, if we can, under 1,500 milligrams a day. Like, yes, ideal is under 2,300 or 2,300 is kind of the threshold. Yeah. And we're usually getting 3,400, 3,500 or more. That's what the average American is getting, way more than that. But the American Heart Association is even recommending closer to 1,800 or even 1,500 milligrams of sodium a day. The couple things I wanted to just add about high blood pressure that I talk to every single patient who comes in to see me regarding their blood pressure. There's 4 things we need to check these boxes off to make sure we've looked at these. Number 1 is alcohol. Even alcohol in moderation raises your blood pressure. So if your blood pressure has been running high, and this doesn't necessarily mean like just daily use. It could be daily use of 1 to 2 glasses of wine or 1 to 2 beers, or it could be binge use on the weekends, which has longer term effects. So alcohol should be minimized or eliminated if you're really struggling to control your blood pressure. Number 2, sodium, and she went into that beautifully in detail. And we, on average, throughout the world, but especially here in the standard American diet, are getting way, way, way too much sodium. Number 3, anti-inflammatories. And this is something that is rarely discussed when they're prescribed or people are encouraged to take them for pain. So anti-inflammatories are things like ibuprofen, Motrin, Aleve, Advil, naproxen, Celebrex, Mobic. No, not Mobic. What is the other one? It starts with an M. Meloxicam. Thank you. Those are anti-inflammatories. And what they do is they make your kidneys hold on to sodium and therefore hold on to more water. And what did I say that does? It kind of fills your tank like a gas tank. It fills that tank and it makes your pressure high. So anti-inflammatories like that, in addition to raising your blood pressure, have been found also to be a direct risk factor for a cardiovascular event like a stroke or a heart attack. So taking them when you need them because you sprained your ankle like I recently did, yes, fine. As small amount as possible for as short a period of time as possible. But for people, and a lot of people, especially as we're all getting older, have aches and pains, and they're like, well, I got to take my Motrin today for my back pain like I do every single day, or I need to take it at night to help me sleep. Acetaminophen can be tried. That's generic for Tylenol. Tylenol or acetaminophen is not an anti-inflammatory. It's just a painkiller. If that doesn't work, you can talk to your primary care provider or whoever's helping you manage your pain about topical ointments, topical therapies, as well as non-pharmacologic therapy for pain. And that can include anything from exercise, stretching, yoga, massage, heat therapy, acupuncture, if I didn't say that already, those sorts of things. So try and eliminate the anti-inflammatories if possible. And then the last thing that I make sure I just check this box off is get screened. And it doesn't necessarily mean you need to get the study, but talk to your doctor about whether you possibly could have something called obstructive sleep apnea. because untreated obstructive sleep apnea can significantly contribute to high blood pressure, as well as congestive heart failure, as well as atrial fibrillation and other cardiac problems. So most people don't know they have it because it happens when they're sleeping. But I guarantee you their partners probably know they have it if they sleep with a partner. So it's something, and there's certain risk factors that we kind of talk about and we ask about, like daytime sleepiness, sore throat because of heavy snoring in the morning, or a hoarse throat, feeling just exhausted all day long, despite the fact that you felt like you slept 7 to 10 hours the night before. So those are all things. Poor sleep in general it doesn't have to be from sleep apnea, but poor sleep in general can contribute to high blood pressure. So those 4 things.
Doesn't matter if it's mild or severe.
It does matter. Mild is probably not contributing a whole lot. What really is causing the contribution to high blood pressure is that for at least moderate to severe sleep apnea, you can become hypoxic at night. So hypoxic means your oxygen levels drop too low. Hypo. Okay. Your oxygen levels, whether you're sleeping or you're awake or you're running up a hill, should be above 90% when you're not on oxygen. I mean, just breathing the normal air. So when you're sleeping with sleep apnea, it's called obstructive for a reason. Your upper airways, kind of up in here, all the way up towards your tonsils and all the way up in here, are so relaxed. It often is worse if you're lying on your back, but not always. But up in here, you're sleeping so soundly and you're so relaxed, they collapse and they obstruct your airway. That's why it's called obstructive. And what happens is you're sitting there, and I'm sorry for the people who are on Zoom because you might not be able to see exactly what I'm doing. But you're sitting there sleeping and your lungs are trying to suck in air and nothing's going past the obstruction. Okay. So you're sitting there and then all of a sudden you kind of wake up and you take a breath. Well, what made you wake up? Your brain sensed these really, really low oxygen levels. I mean, people can be not breathing for over a minute, where they're just not breathing. Their lungs are trying desperately to get a breath. Oxygen levels are starting to dip and dip and dip and dip. And then finally your brain's like, okay, I gotta wake this guy up because they're not breathing. And so you wake up from your really deep restorative sleep. It's a partial awakening where most of us are not aware that we've kind of partially woken up. We take a breath, and we take some good breaths, and then we get back into that deep sleep again, and the same cycle happens over and over again throughout the night. So it's those low oxygen levels that cause the problem with the high blood pressure, because it stimulates our sympathetic nervous system, which essentially raises our adrenaline levels all the time. Not just while we're sleeping, but then throughout the day, the next day. So, Charlie.
So I'd like to go back to food for a moment. Specifically, Dr. Esselstyn recommends a lot of dark green leafies and nitric oxide. If you could kind of discuss whether that will lower blood pressure if you're eating dark green leafies regularly. And the second issue would be the use of oils, which so many people feel are so healthy. Does it lead to inflammation? Does it cause a constriction of arteries, and maybe increased blood pressure?
So to touch on the dark leafies, like you were asking about and about your warfarin. So we get the question often about, well, I can't eat dark leafy greens because I'm on Coumadin or I'm on warfarin. You can. That's why you go to the vampires and get your INR checked so they can dose your medication based on what you're eating. The goal is to keep it consistent. As long as you're consistent, you're fine. The dark leafy greens are super, super good for you. You can eat them roasted, you can eat them raw, you can eat them steamed, however you want. Just please eat them. And then in regards to the oils, so the monounsaturated fats, olive oil, avocado oil, avocados are all good monounsaturated fats. We want to stay away from the saturated fats. So anything that ever came from an animal is going to have saturated fats, with the outlier being coconut. Coconut oil is a wonderful topical. It's great for your skin. It's great for your hair. Just don't ingest it in your body. It's like putting diesel in your gas car and saying, boy, I hope we get to Portland. I'll say, Well, I hope you remember how to hitchhike, because you're probably not going to make it too far. So yeah, stay away from coconut oil.
And palm oil.
Yeah, and the palm oils too. Yeah.
Basically, the tropical oils, I think, is the safe bet to stay away.
Yeah. Just use avocado oil and olive oil, or eat avocados. You can bake with avocado oil because it doesn't really have a flavor. If you don't like baking with olive oil. And avocado oil works great if you're more like I'm not retired. So when I wanted to eat 5 minutes ago, I didn't want to wait. So I'm going to turn that pan up high and put avocado oil in there and it'll work great. But pardon me, high heat. Yeah, it has a high smoke point. Yeah, so if you want to saute stuff on a high heat, yeah. And you can also use like vegetable stock to saute stuff in also if you want to like get away from the oil even more. Yeah.
So I think that's confusing. It confuses me. It's got to confuse other people.
Yeah. Yeah. So, I mean, in moderation, I mean, some people are more comfortable cooking with a little bit of oil in the skillet, or they want to use an iron skillet. So they're going to put a little oil in there so nothing sticks to it. Moderation, not a lot. It does a little goes a long ways. And you can use like vegetable stocks in there to saute stuff and it won't stick. Just don't turn it up quite as high. Kind of like the lower is better. So the least amount is better.
Well, too, you put a little bit on the napkin, and just rub it on.
Wipe it in there. Yeah.
That's it.
Yeah, you don't have to pour it.
No.
Yeah. Just enough so things don't stick.
And also keep in mind, when it comes to oils, a little bit is probably fine, but really keep it lower is better. For people who are trying to lose weight, I think this is probably something you've all heard if you've come to any of the classes. Maintaining a healthy weight is so important for so many reasons. And this is probably we're not going to have time to talk a lot about weight loss in this particular discussion. But if somebody's goal is to lose weight, to improve their blood pressure, to improve their cholesterol, to improve their fitness, to improve their metabolic problems like diabetes, fat of any kind. It can be the healthier monounsaturated fat. It can be omega-3 fatty acids. It can be saturated fat. It has 9 calories per gram. And when it comes to oils, those grams add up really, really quickly. So 9 calories per gram, while carbohydrates, especially those good, complex, nutrient-dense, low-calorie carbohydrates, are 4 calories per gram. And protein of any kind is 4 calories per gram. So that's one thing, small amounts of seeds or nuts are really, really good for you. They've got good omega-3 fatty acids. They're good for your brain health. And there's actually some evidence that they can be good for lowering your cholesterol, but a small handful, because that contains quite a bit of fat. And if somebody's goal is to lose a few pounds, really watch those fat calories.
To tag on to that also, to put a quantity to it, 2 tablespoons of peanut butter has 180 calories. 6 cups of broccoli has 180 calories. Which one's going to fill you up more?
Bounce to the question in the chat. There's 3 of them there. Let's go with the first one. GLP-1 helping or hurting heart health?
So in general, GLP-1s, if you are otherwise a candidate for them, are good for your heart and can help prevent certain outcomes, especially related to congestive heart failure. But I think the jury is still out. I think we need more longer term information. And remember, those GLP-1s, which are primarily used for weight loss, or that's what they're known for. We've got to have a good system and a process for people to be able to come off of them at some point without losing all of the gains that they just made, if that makes sense. Because what happens is, what we're finding historically is that people tend to gain quite a bit of the weight back once they stop them. So What about nuts? I think I answered that. In moderation, nuts are great. 1 or 2 Brazil nuts a week, or maybe 1 or 2 twice a week, can be good at lowering your cholesterol. You don't want to do too many Brazil nuts because that you can have selenium toxicity. Walnuts and cashews have been, along with the Brazil nuts, have been shown to help lower cholesterol. I don't have amounts, maybe you do, but probably small amounts, but they're helpful.
Yeah, a quarter cup is generally what we tell people of nuts per day, unsalted. Again, because we want to watch the blood. Walnuts are a really good source of omega-3s. So chia seeds, walnuts, and flax meal are really good sources of omega-3s. They're anti-inflammatory, so including those as part of a healthy diet is excellent. And walnuts are plentiful around here. People have walnut trees. They'll gladly let you come glean in their yard for walnuts.
Yeah, there was a diet that was studied to look at dementia prevention called the MIND diet. And one of the foods that it emphasized are some nuts, especially walnuts. And it was a successful diet at slowing or preventing cognitive decline. So eat your walnuts. And then what about coconut milk or coconut cream? Yeah. So I'm really paying close attention to any vegan yogurts that I buy, and I try to get the ones that are like oat milk or cashew milk based, not coconut milk based. Now, I have to admit the coconut milk based tastes very creamy and very rich. That is the point, because there's so much saturated fat in them because of the coconut milk. So, and I love like curry, I love Thai food, but I try, if I ever do use the coconut milk for, like, if I'm making Thai food, I get the light and I use less than what it calls for. And I just don't use it very often. It's really not a good food. So, that would, I guess you could say that's one of Dr. Linzmeyer's weaknesses is Thai food. So just kind of keep that in mind. Coconut of any type, except for maybe coconut water. The coconut water is probably okay because that's a good source of potassium and there's no saturated fat in it.
Since you're on milk, what about almond milk? Almonds, no.
I mean, I can't remember if this was Dr. Greger it was one of the kind of grandfathers of the whole lifestyle medicine, lifestyle medicine, development, said that, when it comes to saying like, what about this food or what about that food? There certainly are some foods that we could say they're probably bad foods. Like we just talked about coconut oil and processed meats. I'd put those in there, and then there's certain foods that there's really like, there's nothing harmful about them at all, like the dark leafy greens, the broccoli and things like that. But there is the vast majority of food is kind of in the middle, where if you're drinking almond milk or oat milk, is there another, something that's a healthier option? Well, water is probably healthier, and actually eating a small handful of the actual almonds, but that's not the milky substance that we want. So, but is almond milk or oat milk healthier than dairy milk?
Right.
Yes. So there's almost always a healthier choice and almost always a less healthy choice. So when you're eating anything, just think, yeah, this is actually a pretty healthy choice. I'm happy with my choice. Or, maybe tomorrow I think I'm going to choose something a little healthier. Think about it that way. And that way we're not judging ourselves too harshly. Yeah. Oh, sorry. One more thing about those non-dairy milks to kind of go along with what Cecilia was talking about. Look for those darn added sugars. It drives me nuts that they add sugars to these non-dairy milks. So my favorite is Eden soy. I love soy milk because I get that extra protein. And Eden soy unsweetened, no added sugars. It's really high in protein. But just look at all of the backs of those. Be really good about reading those labels because it's amazing what they sneak sugar into.
Can you explain what tricuspid valve regurgitation is? Was that not easy?
Yeah. So I don't have a diagram, but you have 4 heart valves. And When blood has been taken, it's gone to all of your muscles and all your organs, and all of the oxygen and nutrients have been extracted, it then gets into your veins, your entire venous system, and goes back up to your heart. And it goes up to the right side of your heart. And the first valve, it first enters the right atrium, and then there's the tricuspid valve, and that opens and allows all of that blood it's a dark blood, it's not oxygenated anymore, and it enters the right ventricle. So the tricuspid valve tends to leak a little bit when it closes. That's pretty common, and it's pretty physiologic. So if you were to get an ultrasound of your heart and it said you had trace tricuspid regurgitation or mild tricuspid regurgitation, I would not have too much heartburn over that. Okay, it's very physiologic, very common. Because as the leaflets close, just a little bit of that blood kind of leaks backward in the direction from where it came. Then from the right ventricle, it pumps blood past the pulmonic valve into the lungs, where it picks up oxygen. And then from the lungs, it goes to the left side of the heart. And you have two more valves over there, the mitral valve and the aortic valve. And those, the heart is just a pump, just like a plumbing system. And these are supposed to be one-way valves. They open to let blood go through, and they're supposed to stop to allow very little, if any, blood to leak backward. So if you get damage to the valve, or very commonly the heart chambers are starting to enlarge and dilate, so the valves themselves are normal structurally, but they're no longer kind of coming together like this. They're getting stretched apart, so there's this big gap in between. So that's when you can get regurgitation. The other name for, sometimes you might see something like insufficiency, tricuspid insufficiency. It just means it's not doing its job anymore. So it's regurgitating. It's kind of same thing. Yeah. Yes.
The older I get, the less appetite I have.
Yeah.
My lifestyle, I don't want to spend a lot of time with food prep, so I do a lot more steaming. And I try to eat as many different colors as possible. But compared to what I used to eat, I have like 1.5 meals a day. And that's it. Even with spending 45 minutes or an hour every day doing something physical. Is that normal?
Is it normal for appetite to decrease as we age is the question that I'm hearing. Okay. From my experience, yes. Because even though you're still active, you might not be burning as much calories as you were burning prior. And your muscle mass has changed also, and your muscles burn calories. So yeah, that's normal. To be tired of cooking, that's normal too. But I would say if you can cook once and eat multiple times, do a whole sheet of vegetables, roast it up, and then eat what you want, put the rest in the fridge and eat it later. Mix some beans with it so you have some protein in there too. Easy peasy.
Yeah, would that be kind of your tip as far as if somebody really is not as hungry and they want really high nutrient dense foods, beans, handful of nuts.
Yep. Whole
grains.
Yep. Fruits and vegetables. Yeah.
You were talking about having tests done on your neck or do you have to ask your doctor for that? Or should it be something that's just a regular visit?
If you're over the age of 65, there are certain screening tests that will be covered by Medicare. That is one of them, as well as a screening of your abdominal aorta to look for an ultrasound. To look for an aneurysm. It's another ultrasound. So those are things that if they're not offering, it's not because they don't like you. It's just probably they're covering a lot of things and they didn't get around to it. So you can ask for it. Yeah. Now they may say, well, listen, if your blood pressure is normal and your cholesterol is normal, yeah, we can screen for it, but the likelihood that you have it, unless you've got a certain genetic predisposition, like a very strong family history of aneurysm formation, which can be the case, they may say you probably don't need it, or you're not a smoker, or you never were a smoker, so they may say, we can do it, but you're such low risk. Yeah. Well, and again, so it may be that they just think you're low risk, but I just bring it up next time. Yeah. So we're starting to, I know Cecilia's had a very, very busy, in addition to working all day, she then did a diabetes support group. and now she's here. So I think we could take one or two more questions if we have any, and then probably wrap it up so she can get home and maybe eat something.
Food is not overrated.
Yeah.
Hi, I'm
Everybody.
I'm
and
online. Can
go
I
ahead.
ask a question? I'm online and actually have 2 or 3 questions for you.
Next week is diabetes. We'll be covering that. I'll be doing a talk on that with a PowerPoint presentation and stuff. So hope you join us for that. Is everyone? Yeah. See you.